Hello everyone. Today for our therapeutic research, we're going to talk about determining the efficacy of cordyceps extract in treating chronic kidney disease. Chronic kidney disease, or CKD, is a disease which is defined by symptoms of kidney damage, such as reduced glomerular filtration rates and increased urinary albumin levels. Other indicative symptoms also include hematuria, weight loss, shortness of breath, itchy skin, and persistent headache. CKD is also known to catalyze the development of cardiovascular disease, anemia, and mineral and bone disorder. Currently, the global prevalence rate of CKD is approximately 10%. For people ages 65 to 74, 1 in 5 men and 1 in 4 women have CKD. Cordyceps sinensis extract, or known as the Chinese caterpillar fungus or simply cordyceps, has been one of the most popular herbs used in treating CKD for nearly 2,000 years. Numerous bioactive constituents have been extracted from Cordyceps sinensis, such as cordycepin, ergosterol, mannitol, and these chemical components have demonstrated hepatoprotective and inflammatory effects as well as nephroprotective properties. However, it is still unclear as to whether one chemical constituent is responsible for beneficial properties or their synergistically created properties, which lead us to research this question of how do cordyceps extracts help decline the degradation of chronic kidney disease in CKD patients. And we want to investigate whether using cordyceps extract as treatment can decrease the degradation of chronic kidney disease.
It is a significant public health problem, especially due to its slow and asymptomatic progression, which leaves its victim with kidney failure at its end stage. Efficiently testing drugs to slow the progression of CKD has been a major challenge for institutes all over the world, since the beneficial effects of treatment don't manifest in patients for many years and require longitudinal follow-ups. Due to this, not many effective treatments had been discovered. This study will be looking into the efficacy of using a traditional Chinese herb extract, which called cordyceps extract, in treating chronic kidney disease. It is significant to society because it had anecdotal confidence to support its efficacy, and conducting a proper control study will allow confirmation to be found regarding its use. If we are to find that cordyceps extract can be used to treat chronic kidney disease effectively, it will impact the life of 13.4% of people in the entire world, along with the individuals who may be affected by the CKD in the future.
Our type of research and study design is therapeutic study, randomized clinical trial. For our data collection, to examine whether cordyceps extracts play a significant role in declining the degradation of chronic kidney disease or CKD, a test sample of 100 patients with stage 3 CKD aged 65 to 74 are chosen for this study. The sample is then divided into 2 equal blocks through block randomization, with the same number of males and females in each block. One group will receive cordyceps extracts as one of the treatments, while the other will be placed on placebo. This experiment involves double blinding, in which both the physicians and patients do not know what treatment they are getting or who get the cordyceps extracts, and this will reduce chances of researcher bias. Components of urines, glomerular filtration rate, urinary albumin levels, blood creatinine concentration, and blood urea nitrogen concentration will be measured, and the results will be compared among the group members and between the groups. If the group that is given the extracts have values closer to normal, it can be concluded that the cordyceps extracts help decline the degradation of CKD. To justify our ethical choices, there would not be a control condition or no case patients, because it is not ethical to administer a therapeutic drug to people without the condition, as it may pose unknown harm to the individual. So a placebo group will be more suitable. Moreover, in order to have the study remain ethical, all patients need the standard treatment for CKD. Therefore, it was decided that the sample would consist of patients with stage 3 CKD, as the standard treatment does not involve dialysis. This is important because dialysis may filter out the substances involved in the cordyceps drug mechanisms that are beneficial to the CKD patients.
For our inclusion-exclusion criteria of study population, we will include age range from 65 to 74 years old, and we are focusing on stage 3 CDK. And in order to minimize our bias, we have to set an appropriate exclusion, which actually divided into co-intervention confounder, alcohol consumption, caffeine consumption, smoking, and prognostic confounder, which are allergy to cordyceps extract and other fungi, mental disorder, polycystic kidney disease, autoimmune nephritis, and also diabetes.
As for the evaluation part of this study, there will be several interferences and limitations of the study that we have to take into account prior to doing the investigation. Due to this study being a placebo-controlled clinical trial, there will be many ethical considerations to consider, some of which must be breached in order to maintain the validity, the generalizability, and reliability of the study. There are 5 main ethical considerations to take into account. First of all, we have right to withdraw. This ethical consideration must be maintained because participants have to be able to withdraw from the study if they don't want to continue it anymore. Hence, if they do, it will be an inevitable limitation. Next up, we have deception. Since this is a placebo-controlled trial, there will be an experimental and a placebo group. The placebo group obviously will not know whether they're getting the drug or not. Same with experimental. However, that's deception, and in order to counter this deception, we must debrief them after doing the trial and inform them whether they were experimental or placebo. And next up, we have informed consent. So, informed consent must be given prior to the investigation. And this means that the participants must understand the risks and that there is an experimental and placebo group and they have equal chances of getting into either group. And they also have to know that what the implications of the data may be in the future. Next up, we have protection from harm. This may not be able to be completely fulfilled, as patients in the placebo group will find out that at the end of the study that they did not receive the drug and may be hurt from the study. Although some of these points are not limitations, they still have an effect on the results of the study. Another limitation of the study is that the sample size may be too small to produce statistically significant results representative of the population. A larger sample is required to provide more significant data and identified anomalies. Also, since the time period of which the cordyceps extract drug is effective is unknown to researchers as of now, we couldn't determine an exact time period to conduct this trial and achieve results. Hence, there's a limitation on the time constraint. If we set the trial period to be too little, we won't get statistically significant results.
For systematic errors, to eliminate confounders, we will set following rules for all participants to follow during the period of the trial. The first rule: participants are not allowed to take any drugs that may have an effect on the kidney. If there is a case where they require these drugs, they must inform the researchers and have the researchers give the drug themselves. If necessary, the participant may have to be taken out of the trial. The second rule: researchers will set up a diet plan for all the participants to follow so that the same type and amount of nutrition is given to each participant and is controlled. The third rule: all participants must get at least 7 hours of sleep each night and keep record of their sleep.
Information bias. Since our measurement technique is to measure the patient's glomerular function rate, this is an objective measurement system and thus will eliminate information bias. Prognostic bias can be controlled by a randomized sample where we use the randomization block method to place participants into placebo and experimental groups. Since the study is double-blinded, both participants and researchers don't know which patients are in the placebo or experimental groups. Therefore, group assignment is concealed and does not pose a risk to the study's validity. Selection bias. Use block randomization technique to eliminate selection bias and allow for participants to have equal chances of being the placebo or experimental condition. When finding the sample of participants, must check off all the exclusion and inclusion factors listed above, such as patients must be age 65 to 74 with stage 3 CKD and does not smoke. By the end of the trial, there must be at least 80% of participants left in the trial in order for the results to be non-biased and valid.
This is the table that shows the characteristic of patients in the studies. And the second table, this is the outcome measurement with data obtained from previous researches. The table includes the experimental and placebo group with the 4 measurements, and before and after value are put in the table.
Since we're using t-tests, we are comparing between two means. By convention, we use alpha value 0.05, power of study 0.8, two-sided test, and N1 N2 ratio is 1. In this calculation, we use the values of blood creatinine, the after values, which are 87 for experimental condition and 85.2 for placebo condition, while SD1 and 2 are 2.36 and 2.38 respectively. To compute the estimated required sample size, as it provides the most suitable or largest size of n, the total of 228. On the other hand, calculated sample size based on glomerular filtration rate, urinary albumin levels, and blood urea nitrogen are 88, 8, and 10 respectively.
The factors that must be considered when calculating the risk estimate. First, mortality rate. It is the total number of new deaths in a defined time period. Second, experiment event rate is a measure of how often a particular statistical event occurs within the experimental group of an experiment. Third, control event rate is the proportion of participants in the control group that have the outcome. Fourth, absolute risk reduction is the difference between the risk of an outcome in the exposed group and the unexposed group. Lastly, the relative risk is the ratio of the probability of an outcome in an exposed group to the probability of an outcome in an unexposed group. The experiment event rate, control event rate, and absolute risk reduction can be calculated by using this formula. The formula of experiment event rate is A over A plus B, control event rate is C over C plus D, and absolute risk reduction is control event rate minus experiment event rate.
For our statistical analysis and hypothesis testing, we'll be using a t-test. But first of all, our hypothesis is if cordyceps extracts are used as treatment for CKD patients, then it will help decline the degradation of chronic kidney disease, which is measured through difference in glomerular filtration rate from the beginning of the trial till the end. And our null hypothesis is there's no significant difference between using cordyceps extract in treating CKD patients, and any observed differences are due to chance. So the purpose of hypothesis testing is used to find out whether an assumption is plausible or not. It is done by examining the data of a sample of a population to find evidence to see if the treatment really has a positive effect or not. So, what is a t-test, and what is the difference between an independent and paired t-test, and why we use the independent t-test in this situation? The t-test shows how significant the differences between groups are. In other words, it lets you know if those differences could have happened by chance. The t-test has many variations to it, but in the case of this research study, an independent t-test will be conducted rather than a paired t-test. A paired t-test should be used to statistically analyze data when two conditions are placed on the same sample. This means that one sample group will have two sets of data collected from them under different conditions. However, this study will be conducting the same test on two different groups, and thus an independent t-test will be used due to the sample groups being independent of one another.
So, what assumptions are made in a t-test? The most popular type of t-test is the independent sample t-test, also known as the unpaired sample t-test. It helps you to compare the means of two sets of data. Since it is a statistical test, it should contain the following assumptions. First, assumption of independence, requiring two independent categorical groups describing the independent variable. Second, assumption of normalities. Assumption of normality is the dependent variable should be distributed approximately as usual. We can calculate the independent variable on a continuous scale. Last, assumption of homogeneity of variance, which means the variance would be equal for the dependent variable. Although there is a manual way of doing the t-test, which is by collecting the data and inputting it into the following formula and steps. However, we will be using a program to help us with the test, as it is much more efficient and reliable. So, how to analyze results from a t-test? The t-score is a ratio of the difference between two groups to the variations within the groups. The larger t-score indicates a more significant difference between groups, while the smaller t-score suggests that the difference between groups is insignificant. For instance, if the t-score calculated from the experiment is 3, it means that the group which is cordyceps and without cordyceps are 3 times as different from each other as they are within each other. Therefore, the result will be supportive of the alternative hypothesis.
Lastly, this is our reference. All of them are created by using EndNotegram. Thank you for your attention.